Good evening, everyone. Welcome to the salon. Very cozy tonight. I'm very pleased to see you here tonight. We're going to be talking about Zika in Central America, a public health problem, and a feminist challenge. And I'm going to skip the introduction to DJPC and the salons because we're all very familiar with our missions and the purpose of the salons. I'm going to quickly introduce you to Maria Hamlin Zuniga, who has been a health activist in Central America for over 48 years. She's lived in Nicaragua and Guatemala, and she, by profession, is a health educator with a master's in public health of the University of Minnesota. She is the founder and president of the board of directors of the Center for Information and Advisory Services in Health, CISAS, in Managua, Nicaragua, a non-governmental organization that was established in 1983. She is the founding member of the Regional Committee for Community Health and a network of primary health services working for the last 38 years in Central America, Mexico, and the Caribbean. It was established in 1975. She also founded the Association for Community Services in Health, ASECA, in Chimaltenango, Guatemala in 1978, and has been working in collaboration with them for over 35 years. And she's currently serves as an advisor to the association. She also founded and was previously the global coordinator of the International People's Health Council, an international network working on health policies. And is a founding member of the People's Health Movement around the world and the Latin America chapter. And without further ado, I'm going to let Maria speak for us, and then we're going to open the floor for questions.
Okay, good evening, people. There are not a lot of you there, so why don't you tell me who you are before we get started?
Yo soy Margarita.
I'm Margarita.
Hi, I'm Harriet Delaney.
Jerry Stuckey. I'm Preston Enright.
Amy.
I'm Amy.
Hi, Amy.
I'm Colin Bruce.
I'm John.
Okay, it's a small group, and so I don't want this to be formal. Rebecca said that I'm a health activist, and being a health activist and working in the politics of health, me and my colleagues who are part of the People's Health Movement are very interested in this particular epidemic. I just wanted to give you some background because we talk about Zika as if it's a very scary thing. Yet here in Central America and parts of South America, we're much more concerned with other viral diseases that have had a great impact on our populations over the years. And one of those is yellow fever. And if you've ever read anything about the establishment of, or the building of the Panama Canal, you might know something about yellow fever. Whoops, I just lost you all. Also, we have dengue. In the last couple of years, we've had chikungunya, and now we have Zika. And the interesting thing about all of these viruses is they have the same vector. And that vector is Aedes aegypti, a mosquito that lives basically in fresh water. It's a domestic kind of mosquito. And so it is around all of our homes and our communities. And over the years, different methods have been used to control that particular zancudo by generally using pesticides or granular substances that are put in the water to destroy the larva of this particular mosquito. Now, being a health educator and being somebody who's worked in popular education using Pablo Freire's methodology for so many years, I really am not in favor of massive use of fumigating neighborhoods and houses or using poisons when there are other ways of controlling these particular mosquitoes. Whether we want to do that individually in our homes and in our families, or if we want to do it in a community. And that's by using health education. And one of the things that those of us who are in the People's Health Movement really work hard to do is help people become aware of, become knowledgeable about their health, so that they can make decisions about what they want to do. And when governments decide to use massive vertical programs that are decided from the top down, that cost lots of money, we question these particular kinds of programs. And that's what's happening in this particular epidemic. And if you're able to read about the epidemic, if you go to the webpage of the World Health Organization, you will find recommendations from the World Health Organization on the control of vectors, the one vector that carries these 4 diseases, 3 of them that are very much epidemic in our countries of Central America. They recommend the vertical programs, the ones that cost money, the ones that require doing business with pharmaceutical companies and with companies that manage agrochemicals. Well, some of us ask why. Why is that so when there are so many things that we can do ourselves? You know, recently, a few months ago, in the New England Journal of Medicine, an organization called CID, which is an international organization that does health investigations, published the results of almost 8 years of work here in Nicaragua, teaching people how to identify the larva of this particular mosquito. And they found that in the areas where they trained, particularly young people, to identify the larva and then to clean up the receptacles in which water was being held, they were able to eliminate those mosquitoes in those areas where they had carried out this particular study. And this was a pretty massive study here in Managua. There are areas of Managua that are epidemic with these different diseases carried by this zancudo, transmitted by this mosquito, excuse me. And there are other areas where they did their research over 8 years and where they trained young people to identify the larva, and there are no mosquitoes in those areas where they trained the people, and there are no diseases that are carried by, that are caused by this particular virus, and that are transmitted by these mosquitoes. Now, that makes you wonder, no? Why it is so that people can learn to do the things to take care of their health and avoid disease? Why do we continue to push for technological solutions to health problems? Well, this is part of what we call the medical industrial complex. That's really what it's all about. A lot of money is made off of disease. There's no better place to understand this than in the United States and the debate around whether there should be a single-payer healthcare system. Why isn't there health for all in the United States when that's the goal of so many of us in parts of the world where health services and healthy neighborhoods are not so easy to come by? I think that we have to ask serious questions about how health is delivered and why it's delivered the way it is and what we can do about this. And I think that the H1N1 influenza that we had a few years ago clearly showed how big business was mixed up in the recommendations for what people should do about the particular disease in their communities. And I fear that the same thing is going to happen in the case of Zika. Now, Zika is not a frightening disease. Zika actually only shows up clinically in 1 out of every 5 people who have the virus. In other words, it's not something that causes you a lot of grief. Dengue causes a lot of grief, can be very dangerous, and if you have repeated cases of dengue, then you end up with hemorrhagic dengue, and you can die from that. Chikungunya is this other disease that's carried by the same mosquito, and it is extremely painful for people who get it. They get severe pains in their joints, and they don't go away. And I know people who, over a year, have been suffering the consequences of chikungunya. And because it shows up, it's a clinical case, we have many more cases of dengue, and we have many more cases of chikungunya that are identified. One of the things about Zika is that we don't have specific tests to determine who has or does not have Zika. And it's only in the next few weeks that the Central American countries, Salvador and Nicaragua and specifically, will have the means to test for that disease in our countries. And part of that will be made available through loans and grants, but mostly loans. And so we will be able to test here, and we will be able to test people even if they're not showing up with clinical cases. For example, if a pregnant woman comes into the health services and wants to know if she has been exposed to the virus, at the present time, that information is not available to her. Our samples for determining whether there is actually a case of Zika in Salvador and Guatemala, at least, those actually go to Colorado to be tested. And so we don't have that technology available to us. So the number of cases that have been identified are really not proven cases. They're sospechosos, they're suspected cases, right? And so we have a lot of suspected cases, but we don't have a lot of proven cases of Zika in our countries. However, there's pretty much a huge reaction to what's going on with this disease in the Central American countries. And there's a lot of fear in the population because basically they don't understand how they can actually be involved in preventing this disease. Is the light going on and off on the screen?
No.
Well, I think you all are on mute. I hope it's all right. It's sort of blinking for me. In any case, what I want you to be aware of is that there are a lot of doubts about what are the real causes of the effects that are being attributed to Zika in this case. There's a lot of discussion about microcephalia, about babies developing with smaller brains, that's microcephalia. But microcephalia can be caused from any number of viruses. It's not just something specific to Zika. So it's not necessarily, there may be a correlation, and people are studying why have there been more cases of Zika in Brazil and in El Salvador, with children being identified with possible microcephalia. In the case of Brazil, those would be cases where the child has been born. In the cases of Salvador, it's something that is feared and is showing up in very few pregnancies. The other thing that started showing up in El Salvador in the month of November, December, were cases of Guillain-Barré. Guillain-Barré is syndrome. It's not a disease, it's a syndrome. And people who have it develop paralysis. It usually is a light paralysis and goes away with time. But in some cases it can be severe and it can last for a long period of time. Guillain-Barré is also caused by other, probably caused by other factors in the health or in the environment of people. What has happened over the last few years is that we've seen that there are emerging, what we call emerging diseases. These diseases have emerged at the same time that we've seen climate change and global temperatures changing a great deal, where we're finding diseases that were not previously found in areas that are higher or colder. We see that the vectors and therefore the viruses are moving up to higher altitudes, or they're moving up to areas that in the past were cooler and now have become warmer. That's a definite relationship to climate change. But what happens if people are medically oriented, which most of our populations, even populations that have had a lot of health education, are very medically oriented because we're bombarded all the time by the pharmaceutical companies, that we need the medicine for this and we need the medicine for that. So people have a mindset that prepares them to think about, oh, this is a medical problem and I have to look for a medical solution or a technological solution. And that just isn't the case. In a critical epidemiology, we talk about social determinism. The social determinants of health are those determinants that are outside the biological factors. They may be economic factors, and that certainly is a case in our countries. And when I say our countries, I mean your country, the United States, as well as our countries of Central America. We have, besides the economic problems, we have cultural determinants of health. We'll get into those in a bit when I start talking about a feminist approach. We also have determinants of health that are related to political decisions that are made and political will, which I mentioned a little bit earlier. When governments decide on the technological fix instead of working to empower their people, governments usually want to have power over people. They don't want people to have the power, unfortunately. And so one of the ways to do that is not provide them with the information that they need. And that's what's happened here in Nicaragua to a certain extent, because the people who have done the study of teaching young people how to identify larvae haven't been able to develop that as a national policy. And the national government knows about this study. They know how successful it has been. The people who did this study are people who are sympathetic with this government. They're not overly critical of this government, and yet this government has not decided to implement that people's solution to the problem of the vectors, because this is an election year, and they want to be able to show the services that they're providing to people. In the last few months, we have been fumigated repeatedly. In fact, we finally had to tell the people who came from the ministry to stop fumigating our offices, because they were doing it every 3 days. And that's absolutely not necessary, especially since the vectors, the mosquitoes, have a life cycle of about 7 days. So you wouldn't have to do it every 3 days. And it's very uncomfortable. It's poison. And so we asked them not to do one of the regular fumigations that they were going to do. And they also distribute this granular larvicide, which people are supposed to put into their pilas, their receptacles where they keep their water. And that has been found by this study that was done by SEA, that it is ineffective. And so they're using fumigation, and they're using an ineffective method. And I say Nicaragua because that's where I live, and I know that that's what's being done. But it's also being done in El Salvador, Honduras, and parts of Guatemala that are lowland areas where they would find the mosquito. So that's a political decision. That's a political determinant of health. Another determinant of health that's important for us to understand is the investment that a government makes in services that are generally not under the Ministry of Health. And the most important factor that could eliminate this disease in our countries is to have potable water that is delivered by tubes. You go home and you turn on the water, and it comes from the tubes into your house. That isn't true in most of our countries. We don't have potable water delivered by tubes. We have water that's intermittent in its services and is stored in barrels or in these pilas that I mentioned. And that means that the vector can easily find a place to breed. If we want to preserve the health of people in our countries, the number one thing we have to do is to provide safe water. Now, I was shocked of the lack of reaction of people to what is happening in Flint, Michigan. That's a case of a political decision not to provide safe water to people. And in a country like the United States, we regard water to be a common good. It's not a common good in our countries because the investment hasn't been made. But there's no reason why a country as developed as the United States should have anybody suffering from any waterborne diseases, especially poisoning of people, as in the case of Flint, Michigan. So what I've been trying to help you understand are these, what we call social determinants of health, that to us in critical epidemiology are more important than the bacteria or the virus. They're much more important because they have long-term effects on many different kinds of diseases that we deal with. I also said that I would mention the feminist perspective as regards this particular epidemic or the epidemics related to this particular vector. In the case of Zika, because there's a relationship that has yet to be established fully, but there seems to be a relationship between fetal growth and the presence of the Zika virus, this becomes a danger for the mother. Not for the father, for the mother who's carrying this child. And she has to make a decision that in most of our countries is not a decision that is easily made or easily dealt with. She has to decide whether she's pregnant, should she be tested? The tests are not available yet. When they're available, should she be tested? And if she wanted to make a decision to terminate her pregnancy, that option would not be open to her. It would not be open to her in the Central American countries. It's definitely not available, an abortion to save the mother's life or to save the quality of the mother's life when a child might be born dead or born with severe disabilities. That decision can't be made by women in 5 countries of Latin America. There are other countries that have provisions for what we call therapeutic abortion, but that's not available in El Salvador, or in Nicaragua, or in Honduras, or in Paraguay, or I'm leaving one out. Colombia has changed their law, so they now have abortions available to them for therapeutic reasons. Other countries have therapeutic abortion. We used to have therapeutic abortion in Nicaragua until 2006 and 2007, when, as a political decision, all of the political parties decided to oppose all forms of abortion. And therefore, they deprived women in this country of their right to make choices. And abortion for therapeutic reasons existed in this country since the 1800s. And today it doesn't exist because all political parties and the church worked against it. So we've had constitutional requests made to determine the constitutionality of this law, and they haven't gone anywhere in this country, nor have they in other countries. In other countries in the region, specifically in the case of El Salvador, people are talking about how the Ministry of Health suggested that people decide against having children for the next year or year and a half. The reason for selecting a time period is that with time, the virus spreads through a community, through a country, and natural immunity develops. This is the beginning of the epidemic, so no natural immunity has developed to this particular virus. And so the ministry made the suggestion, and feminists from around the world have criticized the Salvadorian Ministry of Health, and petitions have been set up. But I just want you to know that the Ministry of Health of El Salvador, under the former Minister of Health, Doctora Maria Rodriguez, advocated for legalization of abortion in El Salvador. And it's not the Ministry of Health, it's the National Assembly that has to be petitioned by international petitioners, because the Ministry of Health effectively knows that this is something that is the right of women and families, and it is something that they would agree to if it was passed on by the National Assembly. The National Assembly is not about to do that. It's in the hands of the right wing, even though El Salvador has a progressive government. In the case of Nicaragua, no political party will handle it at all, because it is simply against what they have made to be their policy in this country since 2007. But we in the women's movement continue to work for the legalization of abortion, and it's one of the major demands of the autonomous women's movement in Nicaragua, and also what we call the movimiento ampliado, the different expressions of the women's movement in this country. The Women's Global Network for Reproductive Rights has made an important statement, which Rebecca can make available to you if you're working on this at all. It's interesting to have it available. It's a statement about Zika and how government should recognize that combating Zika really requires that human rights are respected, including sexual and reproductive rights, and that denying women their rights is a human rights violation. And it makes suggestions of what can be done. One is that there should be universally available forms of family planning. Another thing that's difficult to suggest in some places in the United States. But certainly we need to have women-friendly, user-friendly contraception available to families, to men and women. And both men and women should be targeted when there are public health awareness programs being developed, because this should be a decision that involves both men and women and shouldn't be the burden of women alone. And also, as I've said before, decriminalizing, depenalizing abortion in our countries. And when there are women who are affected by possible consequences of Zika that are yet to be proven, but that seem to have some correlation in some cases, that services should be made available for the women to come to term with their pregnancy if that's their wish, and that to have policies to take care of children who are disabled children. You know, disabled children in poor countries are often neglected and left to die. We need ministries of health and health services that provide for those young people, those babies and children. The other thing about a feminist perspective in terms of these diseases is, in our countries, who are the caregivers? They are the women. And so whether it's somebody suffering from any of these viral vector-borne diseases, or the products of a pregnancy that ends up with a disabled child, it's always the women who have the responsibility for the care. And this requires a change in the culture, as to what are our sexual and reproductive rights, and a change in our cultures with respect to who are the caregivers in the family and who's responsible for caregiving overall. So I wanted to mention those things from a feminist perspective as well. It's going to take a long time for us to change the culture. The day before yesterday, I went to a presentation of a study that was done here in Nicaragua in 3 areas: in Bilwi on the Atlantic coast, in Matagalpa, and in Managua, of sexual abuse of children, particularly girls, but girls and boys. Sexual abuse, and over half of the cases of sexual abuse, over half of them end up in pregnancies. And under the law in this country, any pregnancy of a child under 14 years of age is considered to be sexual abuse. And yet this is another area where we do not have, we have laws, but the laws are not implemented. And the education around the laws is very weak. So this is another demand of the women's movement, of organized women across the board, that something be done about early pregnancies. Nicaragua has more what are called precocious pregnancies than any country in Latin America. No other country matches us. That's a disgrace, of course, and it's because we do not have scientific sex education as a regular subject in our schools. And under the present government, it's very unlikely that we will have that. In some of the other countries where Zika is a problem and where people are concerned about pregnancies and the result of what may be malformations that are caused by Zika virus, they are attempting to have more scientifically based sex education, but we have a long way to go. And I want to say, just incidentally, in the BBC a few hours ago, it was reported that the Pope said he would consider rethinking the teachings of the Church in relationship to contraception, if this meant preserving the lives of the women. I read this in BBC. I don't have any more information on it. It was just a few hours ago that I saw it. But this is very interesting. Of course, one would expect a different way of looking at things from Francisco than we would from the popes that we've had in the past. This is not to say that we in the feminist movement are really thinking that the church is going to make great changes. Women, whether they are church women or women who are not involved in any way with the church, are working for women's rights in these countries. Some of the most fantastic people working for women's rights, including their sexual and reproductive rights, are women who are religious women in the Catholic Church. So, because they are respectful of and sympathetic with the lives of the women that they work with every day. So there are lots of challenges for us who are feminists in these countries, both in Latin America and in the United States. And what we hope is that people will keep an open mind about what's happening with this disease, and especially try to learn about other documents that are being written by people who are critical epidemiologists, who are saying that the indiscriminate use of poisons in agricultural toxics are endangering the life of people, all people, and that the severe climate change is changing the whole picture of what emerging diseases are in our countries, and that we're actually going to have more of these diseases as climate change increases. Last year being the hottest country on record ever in the history of the Earth, well, maybe not the Earth, but the recorded history. And what that means in terms of disease, and looking at all of this from a broad social determination perspective rather than the biomedical approach. Okay, so I'm open to questions if I'm able to answer them.
Great, thank you.
I have a question. Maria, can you hear me?
I hear you.
Okay. It seems like from what you're talking about that Zika is having an effect in terms of disempowering women. And then I was also thinking about like violence against women and how telling women to not get pregnant for 2 years is pretty unrealistic. And then even if they get pregnant, do they often have the power to decide? But then I was wondering if in terms of the feminist movement and the strategies, if there's a way where this could become a way to empower women to change the culture.
Yes, I think the fact that there's such there's a lot of discussion going on about this. I mean, women want to know. They want to know if there's a danger of them becoming pregnant. It's so interesting to me because I work in different countries in this region, and to see the approach that different ministries have toward this disease and the amount of public education that is done around the disease. And I think that allowing women to question and to ask their authorities to give them more information about the disease itself, if they have the disease, and what will happen to them. I think that that's terribly important. And there's a difference in the way it's being approached in the different countries. I don't know the latest data, but there are a lot of pregnant women in Honduras who are showing up positive for Zika, having those exams being done in other laboratories in other parts of the world. Certainly, it's on the agenda of the feminist movement today because we feel it is so important. And you're absolutely right. When we're talking about women subjected daily to violations by the men in their lives, because most of the violence against women occurs in the family or occurs because of violence against somebody that the person knows and lives with. So they're not able to, many times, negotiate whether they can get pregnant or not, or whether they're going to have sexual relations with the person or not. So we have a long way to go to be able to say that women are empowered, and that this is something that we have to work on constantly. But I think that because studies are being done and because dialogue is taking place around these issues in our different countries, that more and more women are becoming aware of what the problem is and that there has to be some solution for it, and that in the end it has to be a political solution. There have to be laws that are implemented, and violators should not be have impunity. Is that the word in English?
Yes.
Rebecca, is that the word? Impunity, la impunidad. That so many times the violation takes place, and if the woman is able to take it to the authorities, many times the authorities try to talk her out of having any persecution of the violator. And this is common in our countries. But people are trying to do something about it as more and more women are educated into what are their basic human rights, as well as their sexual and reproductive rights. So Zika, somebody said, Zika may be the best thing that happened to the feminists in El Salvador, for example, because maybe it will result in the National Assembly being willing to change the law so that there could be therapeutic abortions. But there would have to be, as I say, more of a correlation between whether these deformities are actually being caused by the virus, which hasn't been proven, or is it being caused by the poisons that are being used to fight off the vectors? That's come up in the case of Brazil. There's a correlation between where people are using a lot of insecticides and where there are people who have microcephalia. We have to remember that it's only just in the last few months that this has become an issue in terms of the Americas. In November, people from the WHO went to Brazil for the first time to study the phenomenon there. So we're talking about the need for studies to be done to really determine the correlation. But in the meantime, we have to educate people. And we have to have people being able to do things. I should have mentioned that besides the identifying of the larva, there are other biological ways to control the mosquitoes. And And one of the ways is to have small fish put into these tanks that are for water storage. And that's being done in 4 municipalities on the Pacific coast in El Salvador. And they are having success in those communities where they implemented that. They do not have mosquitoes in their receptacles. They're able to control them with small fish. So that is being done by women, no? Women have learned to do that. They're taking care of their fish, and they're taking care that they don't have larvae. So that's an empowering kind of solution, but it isn't a massive solution. Okay? Another question or comment?
Well, I guess, hi Maria, I'm Preston. Can
Hi,
you hear me?
Preston.
Hello.
I can see you.
And welcome to Denver via this amazing technology. Skype is new to me, so, but thank you for your presentation and picking up on the biological approaches. Again, there's those economic factors. If it's not making money for these particular corporations, it gets downplayed. It threatens their profit margin. But the women, you mentioned these women have their fish, and I imagine what are some of the other approaches, for instance, restoring amphibian populations. If there are frogs around and salamanders, I think that's another, again, it's so many connected things, economics, ecology, human rights. If you could just elaborate some more on the biological approaches, because I do think...
Well, definitely what you're saying is really important. We tend to separate ourselves from nature. We don't see ourselves as part of nature. We've been taught to control it. And so when we have frogs and salamanders and what we call perros son popos in our house, people want to get rid of them because they think that they're pests. And the best thing that they can have are these creatures who are natural predators of these, in this case, the mosquitoes, no? And so we have distanced ourselves from nature. We have to come back to nature and see how nature and human beings as part of that nature can work together for protecting the life of everybody. From the time my children were small, I didn't want them to kill spiders. Well, I taught them about Charlotte's Web. But, you know, so many people destroy pests and because they call them pests, instead of seeing them as part of nature to help us have an equilibrium in nature. And that's why learning about biological control is really important. And people do that in agriculture, and we can do that in health as well. But we're going against the mainstream, no? And because the mainstream thinks that we need the technological approach, or that we need to use all these agrochemicals. We know that agrochemicals are dangerous. We particularly know that in Central America, because one of our biggest problems here in Central America is chronic renal disease. And chronic renal disease is actually an occupational health hazard because it's found particularly among people who work in sugarcane. And as sugarcane expands and is being developed for use as a combustible, as a source for ethanol, then more sugarcane is grown and more people are subjected to that particular occupational disease. And yet scientists who are beholden to transnational companies are trying to say that that isn't the cause of chronic renal disease. And so we have a huge debate going on in our countries of Central America about this. And the World Health Organization, in this case, actually took on, in terms of PAHO, the Pan American Health Organization, took on the need to study much more deeply, much more profoundly, the environmental causes of renal disease. You see, we use so many chemicals these days that we didn't use in the past. And we still haven't been able to make the correlation between many of the diseases that we have today and the use of chemicals. Even the chemicals you use on a daily basis in your homes for cleaning your house and cleaning your furniture and so on. A lot of those have effects on our cells in our bodies and can cause cancer, but we don't learn that they're cancer causing, right? Because the advertisement doesn't teach us that. So I think that to answer your question, yes, we have to become more aware of what's available to us in nature itself and respect nature and see ourselves as part of nature and not controllers of the nature so that we can live in equilibrium. And that's what we learn from our indigenous brothers and sisters. And I'm fortunate enough to have worked with indigenous people almost all of my professional life. And so I've been able to learn so much from them.
And the power of Monsanto.
Thank you.
Monsanto?
Other comments? What can you do? What can you do to help the solution?
Hi, Mom.
Hello there.
Yeah, hi there. I wanted to
How
ask
you
a question
doing?
about. I'm good. I wanted to ask a question about when Zika gets to the U.S. You know, it's gonna continue spreading and likely hit the U.S. South for sure. Do you have any sense of how that will change the approach to the virus and I don't know, the politics of how it's dealt with? Do you have any sense of how that might play out here?
Well, if you look at the WHO page on Zika, you can actually see where Aedes aegypti is spreading to. I mean, you know, they found Aedes aegypti in Central Park. So as climate change becomes more severe, you're going to get tropical diseases, especially in southern states. And they aren't the most progressive states in the Union. And so it might be hard to get them to see the relationship between climate change and what's happening in their population. But again, I think that what's going to happen in the United States is that they're going to go for the technological fixes and not the educational and the empowering approach to this. So one of the things that we've seen is that people have been talking about transgenic mosquitoes. That has been pushed. In fact, that was true in some areas of Brazil. They had liberated transgenic mosquitoes, and actually the research, there's very good research done on this if people are interested in this particular subject. There is an organization called Gene Watch, and they have done work on genetic engineering. And you can find out more information about that by doing the research. But we're very skeptical of anything that is altering the genes because we know so little about it. And the fact is, in just general evolution, all the mutations that are taking place constantly anyway are changing our genes. And so, and we think that the use of so many chemicals in our life is also altering the genes in our bodies. And you can find a lot of information about that. So, Aaron, I suspect that they will use the technological approach, and they will use the approach that the government, whatever government that may be, knows what's best for people, instead of letting people really learn for themselves all about this. It's also going to, as I said, Zika is a disease that will come on strong at the very beginning, and then people will develop natural immunity to it as they do with any other diseases. And so then you won't have severe cases. And hopefully by this time next year, there will be a lot more research that's being done to really determine the correlation between microcephalia and Zika and the Zika virus, or between Guillain-Barré and the Zika virus. Zika is being blamed, but the fact is that there are so many other viruses and other factors that can cause both the syndrome of Guillain-Barré and also microcephalia. So it can't be pinned down just to Zika virus. But good luck. I don't think you'll be affected too much up there in the mountains of Colorado. But you know, lots of people in the lowlands, in New Orleans, they're going to be hit, surely. Florida, these diseases will spread north inevitably. Yeah. But I worry much more about dengue and the consequences of dengue than I actually do about Zika. And lots of people suffer from dengue. We should have eliminated it a long time ago. Some of you will be interested. Jerry, you'll probably be interested. You know, the dengue was used as biological warfare in Cuba. I don't know if you've seen the research on that, but the Cubans did a good job of controlling dengue because it was being used as biological warfare against them. And that is very well documented. There's some interesting material available on that. And the Cuban doctors can tell you about it too.
Unfortunately, we had a lot of spraying going on the last month, even in Havana,
Oh, really?
I came about 10 days ago, and just the day before I came for eye surgery, and it was coughing spell at everybody in the neighborhood because we had our streets just fumigated. And you would think we wouldn't do that because there's a very high priority on health care in Cuba.
Yeah.
But they had a lot of dengue episodes, all through Christmas season. Lots of friends of mine, they wind up in the hospital. It's very serious. Now, I had dengue in Nicaragua.
Yeah.
And I noticed another interesting thing. You did not even mention the word malaria yet.
No, I'm not mentioning malaria.
Yeah. That's the same mosquito, isn't it?
No, it's not.
It's
No,
not.
it's no. Yellow fever, dengue, chikungunya, and Zika are all Aedes aegypti.
Oh, it's interesting.
It's a different mosquito.
But the
And
technique is the same. People want to spray to kill it for malaria reasons, like DDT in the past.
Yes, yes.
Terrible.
Fortunately, we do not have malaria on this side of Nicaragua. Malaria has been pretty well controlled in Nicaragua. Yeah. But remember, during the revolution, there was a huge effort to control malaria by treating the people who had malaria so that the mosquitoes would not be able to pass it on to other people. That's how we really stopped malaria, was by the treatment of the sick people. And then the mosquitoes would bite people, but they wouldn't be picking up they wouldn't be able to carry the malaria from one to another. Yeah. It's a different kind of disease. It's another disease that should have been eliminated a long time ago, but it wasn't profitable to spend research and development on malaria, and so it still continues to exist. And severely so in parts of Africa where it's a different kind of malaria than we have. We don't have falciparum usually in our countries, but they do in Africa, and that's the strain that kills. Okay.
Margie?
I would imagine when you talk about the possibility of chemicals causing the microcephalia, that the chemical companies would much rather point to Zika that's causing these diseases than have anybody look at the chemicals.
Well, absolutely. But this has been the history of the use of chemicals. All over the world. I mean, chemicals are supposed to be good, and they shouldn't be dangerous for human beings. They should be considered necessary for human life. So the chemical companies, like the pharmaceutical companies, are extremely powerful, as you all know. and I think it's very interesting to see some of this come up in this particular election cycle, the power of the transnationals and how they affect the health of our people. So we've been saying this for a long time, but we are certainly in the minority, and we don't have the resources for doing the education that's necessary. And until we really deeply question this complex, this industrial complex that is medicine and technology and insurance, we're going to continue to suffer the consequences. But when people are so medicalized, even as they are here, it's very hard to use this kind of argument with people. So, anything else?
Hello. From here, from where we're sitting, and as an organization that strives to do international solidarity, what is it that we can do to collaborate with the efforts that you're doing over there?
Well, what I think that you have to do is let people know that there are different points of view about this issue, no? And perhaps because you have ways to get material out, some of the things that I was picking up today, there's a really good report, but it's in Spanish. Maybe finding out if any of this material that is coming out now about Zika and about the agrochemicals could be made available to people in English. I think the most important job that you have up there is educating people and educating people around why the chemical companies are so powerful and why they are not made to be responsible. The report I'm talking about is one that was done by doctors in Argentina and in Brazil. Brazil has a wonderful Institute of Health, and they're doing a lot of the basic research. It's a huge, Abrasco is a huge organization, and they're doing, it's the Association of Collective Health or Community Health, and they're questioning a lot of the statements by the Ministry of Health. So to let people know that it isn't a one-sided, single answer issue, that there's a lot of implications. And when you start digging deeper, you find the relationship between the chemical companies and the pharmaceutical companies, but you also find the relationship with global warming, that there are still people who want to deny it. and how this is going to continually affect the health of people. I think much more has to be done to help people in the United States understand the critical epidemiology that we're promoting in some places in Latin America through the association of collective medicine, social medicine. In fact, there's a journal that is put out in the Bronx called Social Medicine, and it has articles in English and in Spanish. And maybe those of you who are interested in these particular issues can take a look at it. It is a virtual revista, a virtual journal. And it has lots of interesting stuff for people to study and become aware of and do education around. Matt Anderson in New York is the editor. If you just look up social medicine, you'll find it. The Journal of Social Medicine. And I'm certain that they'll be putting something out on this.
You mentioned the World Health Organization, Maria?
Yes.
WHO. I'm sorry, my ignorance. Is there a network among many of the countries in Latin America around Zika that could do more? I mean, like, you could even come to Cuba, you know. But I mean, are there health organizations that are working on this together?
We have what is called the People's Health Movement, which is a worldwide movement of activists of the political economy of health. No? Since this is so sudden, those of us who are in these countries of Latin America where Zika is, we're working with our colleagues in the other countries. For example, the network that I'm most involved in is the Central American part of it, but we're part of the Latin American movement, and the Brazilians are really very active in this. And the Brazilians who are in the People's Health Movement are people who are critical epidemiologists or support critical epidemiology, which looks at processes, looks at overall processes and just instead of isolated factors. No, and this is an example of where you have to look at the process. You have to look at the global warming, you have to look at the lack of sanitary systems and water that's entubada and so on, and have a much broader approach. And the World Health Organization, remember, is made up of countries, yeah? Our People's Health Movement is made up of civil society organizations, of popular movements, more than NGOs. And we are often at odds with the World Health Organization because they represent power. Governments represent power over people. And so we try to lobby the World Health Organization. In this case, we want to work with the World Health Organization so that we can do the kinds of research that can prove or disprove the relationship between Zika and these other conditions. So the governments are getting technical support from WHO. WHO is almost a bankrupt organization, so they don't have a lot of money, but they do have technical assistance, and they are providing that from the very beginning. They had somebody down there in Brazil trying to see where this was all going back in November.
Great. Any other questions, comments?
Just one comment. I think that the Pope didn't quite go as far as what you might have seen in the BBC. Certainly church doctrine is not changing. And what he apparently said was that over the course of the next couple of years, probably the use of contraception would be okay, but not anything beyond that. And I don't think that, well, it is, if, you know, it will, I think, depend upon how it gets administered locally. You know, it's one thing for him to say it, pointing to Father Snooki.
I'm gonna give him out.
Yeah. But would you, condone somebody who came to you and asked, Father, may I use this? So, it was a big deal when he wasn't getting blasted for talking about Donald Trump, probably not being a Christian. Oh,
So,
yeah, if you can hear us, we can't hear you.
We lost your voice.
Yeah, we're not hearing you.
was our mute on and off? No?
Yes, I did. Here it is.
Okay, now we can
Sorry.
hear you.
My pointer my mouse got water. Sorry about that. What I was going to say is that, yes, I understand it will take millennium for the church to move. But church people who are so important to community health here in Central America, at least, our programs of community health in Central America began with church women. Yeah, it began with church women. They started first hospitals and then clinics and programs for training health promoters, and we had more health promoters here in Central America than any part of the world. And many of them were organizations that were groups that started through religious women of the Catholic Church, through people in the Lutheran Church, in the Methodist Church, but by far 75% of the programs were related to the social, pastoral work in health of the Catholic Church women. And Catholic Church women every day make sure that they're giving information to women to save women's lives, yeah? And I think that that's important to know. I probably shouldn't say that because I don't want to get them all in trouble, right? But it's true. I mean, they live and work with these women, and they help these women in every way they can, regardless of what any pope has said, no. And so I think that that's really important to know, that these progressive church women have done a great deal for the health of people in every respect, not just sexual and reproductive rights. All the work around VIH, HIV, and AIDS in these countries was done largely by church women, and in some cases, some church men, but especially the women. And so I think they're the women that are today working on sexual abuse. They're working on trata. What is trata, Rebecca? Trata de mujeres, trata de niños. Trafficking. They have commissions working on trafficking when other people are not working on these issues. And so I feel that some of my closest feminist friends are the religious women that I've had the privilege of working with throughout Central America. Yeah. They're great feminists. Anything else? I really want to thank you. Thank you all and listening to me, and I hope that in the future we can have further conversations and maybe even personally.
Yes.
Okay?
Yes.
Thanks a lot, Rebecca.
Yeah. Thank you, Maria, Mom. We appreciate your time, and obviously we could do it with the technology, and we're happy about that. There might be some ups and downs, but we thank you for taking time to speak with us, and hopefully we'll see you here in Denver soon.
Okay. Thank you very much.
Thank you. Bye-bye.
Bye now.